we're starting to see how important the interaction between our body and our mind is. And also, I guess the chronic pain literature has been monumental in showing the interaction between the two.
Today we're talking with Dr. Sula Windgassen, who is a health psychologist, about some of the associations of mental health with chronic illness. And thanks so much for making the time to chat with us today. We really appreciate it.
Yeah, it's my pleasure. I'm looking forward to it.
Great. And maybe first you can just give us a little bit about your background and your own experience with chronic illness, and also highlight some of the research that you've been involved in on the topic.
Yeah, absolutely. So, yeah, I'm a health psychologist and CBT therapist. And the reason that I got into health psychology was because of my own experiences, experiencing ongoing recurrent UTIs. And then the symptoms kind of morphed into other things. Some had names, some didn't. So it went from urinary tract infection to urethritis to what they didn't know it was, but it was just this constant sensation. And then nobody gave the label of interstitial cystitis, but that's what I started thinking, because it was all the symptoms that I was having. And everyone will know, if they've experienced a chronic illness or ongoing symptoms, you just have to do your own research, because you feel entirely clueless after a lot of these appointments. So yeah, I had all of these symptoms and they morphed into different things. It was causing a lot of stress. I became depressed, and I had to take lots of time off work, which obviously didn't help. And then I started getting chronic migraines, which made everything worse. So yeah, I guess yeah, my journey into then pursuing health psychology as a career was because my dad had suggested that I do mindfulness to help. And I initially found that very it didn't make sense. It didn't make sense to me. I was having a real, potentially these infections that had a physiological basis. I didn't understand why he was telling me to do something like that. But his partner is a clinical psychologist, and she was working with chronic pain, and she was able to kind of give me a bit more context and understanding about why using something like mindfulness might be really helpful to de-amplify pain signals and kind of sensation signaling, and to manage stress, which always helps in the experience of your body trying to fight an infection. So that made sense to me. So I started practicing mindfulness, which is not easy. It sounds easy when I say I started practicing mindfulness, but I gave it a go, and it helped actually having my dad practicing with me for a few weeks. Actually, we did it together, and then I went on a mindfulness-based stress reduction course, and then it did help things significantly. I'm not saying that all of my symptoms suddenly went away, but things definitely changed in terms of how I was responding to the symptoms and how stressful the experience was. It felt more manageable, and that had a cumulative effect bit by bit. And then it was still another year of having sensations and going to these different appointments, and symptoms changed from that chronic sensation that did go down, and eventually it went really, but then I had kind of frequency problems. But again, I just kept practicing, kept exploring, and then looking in alternative medical routes as well. And then thankfully now I don't have symptoms, and I do get those twinges still that usually would have sent me in a spiral. But I guess through all of these different practices and experimenting, it doesn't have the same effect. So I was really interested in the interaction then between the two, between that physical experience that I was having, and my response and the mental processes behind it, not necessarily just in terms of mood, but the role that the brain plays in amplifying these signals and keeping them activated. So that led me to go and study a master's in health psychology, and then I went on to do a PhD looking at cognitive behavioral therapy for irritable bowel syndrome, which is often like a bladder presentation when people have kind of bladder problems. And yeah, there was, it was amazing to see the processes of change in those kind of interventions and how effective they can be. We had so many people in our trial who were, in the clinical range of IBS, moderate to severe, and then no longer having symptoms. They weren't in clinical caseness for IBS by the end. So what I really wanted to do from there was see how we could apply that model of therapy and tailor it and expand it and explore, what needed to change for it to be applicable when people are experiencing not just bladder symptoms, but kind of urogynecological symptoms. And we know that, women get even more of a rough time in the healthcare system than men, for example. So there's a lot of interesting factors there that I wanted to kind of make changes to.
Well, there's so many things that you mentioned that we also hear from other people that reach out to us. So it would be great to go into some of that in more detail. Maybe you can talk a little bit about what research has been done in this space with the kind of mind-body connection or the emotional processing that goes around chronic illness.
Yeah, I mean, we're lucky because it's expanded hugely in the last kind of 10 years, I'd say. And although it's actually really small space in terms of that mind-body connection in relation to bladder symptoms and urogynecology, I'm hoping that is kind of on the turn as well. But we can definitely, as you say, see from the research in, general chronic illness studies that there is, so many scopes for this mind-body connection. So in irritable bowel syndrome, in recent years, there's a huge development in the understanding in that brain-gut axis or gut-brain axis. I always say brain-gut because I come from psychology and all the physicians come from gut-brain. But it doesn't really make a difference because the point is it's an interaction and they're constantly in communication. So we're seeing just how much our brain responds to messaging from the gut and just how much, our gut is actually sending messages to the brain. So, we think about language, gut feelings, and I felt it in the stomach, butterflies in the stomach, and it kind of makes sense with that emotional experience that you feel. There's growing research showing how these things kind of are then transmitted in signals from that gut back up to the brain, and then the two are in this interaction to decide what that then means for our mood, but also for our digestion and what's going on there. And so I guess I guess that's quite an exciting area as well, because I think we're starting to see that the enteric nervous system, which is this second brain that lives in the digestive system, might have loads of far-reaching effects for other areas, other organ groups, other areas of difficulty that we commonly see in chronic illnesses, such as the bladder. I recently read a paper about the gut-brain bladder axis, which was interesting, kind of showing how changes in the gut microbiome might also affect the bladder and things like that. So we're starting to see how important the interaction between our body and our mind is. And also I guess the chronic pain literature has been monumental in showing the interaction between the two. So we've always known about the placebo effect, the idea that if we anticipate something will work, a painkiller will work, we can still get that analgesic effect. So it shows the power of the mind in manifesting physical sensation change and physical change, because our sensation is underpinned by some physical processes, whether they're observable or not, right? And then again, more recently, the nocebo effect, we're seeing that if we anticipate something not to work, even if it is a particular analgesic, that has an effect on it not having any effect. That has an effect on whether it is effective or not. So our mind and our anticipations and what we think are so important then for our physical experiences. And I think the research is really important and fundamental to kind of understand the mechanical physiological process underlying that. Partly because people then feel validated that it's not all in their head. We can see that there is a physical link. But I think, even without knowing the precise mechanisms, because my thoughts are there'll be so many individual differences, both within our own experiences and across people, that it won't always be exactly the same physical mechanisms.
Yeah.
But certainly the takeaway is that, how we're responding to things in our minds, and how we're thinking about things has a huge effect on our physical health and sensation.
Yeah, that makes sense. But it also raises the question of anxiety around an illness like chronic UTI. I think a lot of people develop anxiety because of the constant pain and the unpredictability of the symptoms, but they're often told by clinicians that their anxiety is causing their physical symptoms. So how can we differentiate between the two? How can you know if your anxiety is contributing to the symptoms or if it really is the symptoms that are causing your anxiety?
Yeah, I think that's a really, important question. And that is the real, that's where the healthcare system's failing patients, because, even if, say, there was a open shut case of this is caused by anxiety, and I don't think we can ever really say that, but say, we can say 90% this is caused by anxiety. Telling someone that probably isn't going to help them very much.
Yeah.
It's not going to get rid of their anxiety, and it's not going to explain the sensation very well. So what I tend to do is with my clients and patients is try and differentiate what's reasonable precautions to take and what is reasonable investigations to go down. But at the same time, if when you're doing these things, you still need to manage the anxiety, because whether you go down that route and you find in however many months' time that yes, there was a particular infection and now you're getting the antibiotics, if that entire time you're going down that route you're feeling really, really anxious and you can't disengage until you've got that answer, that's just going to make the whole process completely more taxing and unbearable. So it's trying to kind of do things in parallel, I think. So it's always licensed to investigate and try and work out with others what seems reasonable and feasible, and discuss concerns with healthcare practitioners, but at the same time seeking support for managing the worry and the anxiety that comes with it, because then those investigations and all the different hoops you have to jump through become less stressful, although they're always going to be stressful, but you're able to kind of manage them in a way that feels more contained, I suppose.
That kind of raises the question, and you mentioned this in your own journey, that you were kind of offered this mental health support or the breathing exercises, and your first reaction was, if it's a physical issue, how is that going to help? And we hear that from a lot of people too, that they get offered mental health support and it makes them frustrated because it seems like the focus has been deflected from the physical problem and they'd rather sort that out first. But is there a way that we can frame mental health support so that it is supporting the physical journey to recovery as well?
Yeah, I think you're right. I think part of my job actually is trying to train and educate healthcare practitioners to provide or signpost to that mental health support in a way that makes sense to patients, because as you're reflecting on, the people hear that, and depending on how that message is delivered, it obviously gives that idea that this is all in your head, that's all you need, and then you feel like your physical complaints aren't being heard at all. So yes, I think what I've been trying to instill in clinicians, and it's an uphill struggle, but there are amazing ones out there and very receptive, but it is a culture change for the healthcare profession as well, because they operate from a biomedical model, and that's what the patients want as well, generally, because that's what we've all been conditioned towards. And it's trying to explain health in a biopsychosocial framework. So yes, there's a physiological component here, or potentially this has this is the main cause. There's an underlying physiological component that we haven't yet found, but potentially there's a physiological component that's only part of it, and there's other factors. But regardless of how much that physiological component's playing a part, the social and the psychological are going to have a huge impact on how that physiological component's having an effect. So just giving like an anecdotal example of somebody with, say, some kind of observable physical condition. So I use the example of inflammatory bowel disease, Crohn's or colitis, versus IBS. So in IBD, there's structural damage or degeneration in the bowels, and in IBS it's kind of a functional thing, and it's not necessarily observable, but there is something obviously in both as a physiological component, and both could benefit from that mental health support, because both are going through investigations, they're going through trying to find whether it's the right diet that suits them, or the right kind of eating pattern, and managing symptoms. And so in IBD, that psychological support will be so helpful to just find a pattern and be supported by somebody that can help you figure that out, because actually that's a huge burden to try and figure out on your own. And when we're in a state of stress, which we are in when we've got a chronic illness, it affects how much we can process information. It affects how able we feel to handle things. And if we've got somebody else that can be a sounding board and provide some structure and some feedback in a helpful, responsible way, that's only gonna do us a favor, so we can then reserve some of our capacity to do the things that we need to do, if that makes sense.
Yeah, it makes a lot of sense, because one of the things that people describe as being so frustrating and exhausting of this process is having to navigate your own healthcare, to do the research, to make the decisions. And decision fatigue is a huge issue with chronic illness, and you can get to the point where you literally can't make a decision, or you don't have energy to anymore, and it feels as though nobody will help you. Is that something that a health psychologist might be able to help guide you through?
Yeah, absolutely. I have not heard that term before, actually, but I think that's a really good one, decision fatigue, and it's definitely one that comes out in the qualitative studies, because it is a minefield, and I suppose there's this underlying assumption as well with every healthcare consultation, or with every kind of thing that you're trying, whether it's particular medications or physiotherapy or bladder installations, that if it's working, you're going to see the effect of that within a particular time frame. And sometimes, because when we're talking about the role of the mind body link, because the central nervous system is so reactive and heightened, actually the sensations are kind of encoded in there. So your symptoms, it might be working, but your sensations just persist for longer. So it takes a bit longer, and there's a bit more of a cumulative effect bit by bit. But that is definitely where a health psychologist can also help. So not just in navigating the decisions in the first place, but just providing that kind of feedback and context, and the hyper vigilance that happens when we're trying to monitor, is this working, which has the opposite effect of helping it to work, but it's very understandable, and we have been there.